Hello, lovely viewers. Thank you for joining me again on Health Pavilion. Today on Health Pavilion, we will discuss depression, and my guest in the studio is Reverend Father Anthony Efriye Amponsa. Father is coming from the Kumasi Archdiocese, and he's also a psychologist at Careers and Counseling Center, University of Ghana, Legon. Father, you are welcome.
Thank you.
How are you doing?
I'm doing well. And you?
I'm good. We thank God. So, Father, what is depression?
Depression is an acute form of sadness. And normally we say it's one of the commonest mental health issues that World Health Organization's report is talking about, especially in Ghana. And it's mainly persistence of sadness and loss of interest in activities that we normally will enjoy. And it's supposed to have lasted for quite a significant number of days without any cause or any reason, or sometimes even if there's a cause, it is overly reactive. And so basically that is what we call depression.
So can we say depression is a disorder or a mental illness? Where do we place depression in these two?
Depression itself is one of the mood disorders. There are a number of mental health disorders that has been identified and classified into groups. One of them is the mood disorder, and depression comes in when you see the person has lost the sense of touch in terms of joy. So there's a persistent, as I say, persistent feeling of sadness. Okay, and it's lasted for at least 2 weeks. So to be diagnosed of having depression, you may have elapsed at least 2 weeks. So you don't wake up one morning and you feel so down and you say, I'm depressed.
Oh, okay.
Or you don't wake up 2 days, you are not too happy and you say you are depressed. I want to bring in here a caveat so that we know there's a difference between depression and grief. So should something happen to you, should you lose a loved one, should you lose a job or lose an opportunity, and you are grieving, you are sad, that is not depression. It means there is a cause to why you are doing what you are doing. You have lost a loved one and you must cry, or you must be down. You have lost. So the difference between depression and grief or sadness is that with sadness, there is a cause, there is a reason why you are not happy. But with depression, there may not be any reason at all. Or even if there is a reason, yours is quite overreactive. So that is where I want us to be clear about.
So with this explanation, can a person really identify that he or she is depressed so that he can seek for help?
Normally, people are not able to recognize it themselves. It takes quite an amount of time, and it takes also a form of expert diagnosis. So normally it is a medical personnel that is basically a psychiatrist or a psychologist who can go through all the checkpoints, all the checklists, all the interviews, all the medical assessments, put all together before we can say you are depressed. So you alone or one person alone in his own house or her own house cannot really get up and say, I'm depressed. And to end that side too, normally if you are depressed, your thinking process is altered. Okay, so generally people who are depressed may not accept that they are depressed. So you may not even know. So maybe the summary of my answer is no, because the person may not even know. Yes.
Okay. So Father, are there any risk factors that will make a person vulnerable to depression?
There are basically 4 risk factors. One is genetic. You could be born with depression. Really? Depression could be part of a family. There is something, allow me to be a bit technical. We call something dopamine balance or imbalances in the brain. So If you have a family whose balance system with the dopamine system is not correct, okay, anybody who is born in that line is depressed. Okay, so the first risk factor is, or a cause as it were, is genetic. The second risk factor is environmental. Okay, you are in an environment where everything is channeled towards you. Everyone is sad. You are with a group of friends who are always talking ill of themselves and they are not happy about everything. That could be. The third one is psychosocial issues. Psychosocial issues can come in when constantly. I know of a young man who lost his father. 3 weeks later, lost the sister through an accident. Another time, just after the two funerals, losing a mother, and just at the burial grounds, losing the brother. So a constant, activation of sadness and grief, combined can bring you enough depression. You see, so that could be. The fourth risk factor is medical. It could be effects of some types of medications. It could get you depressed, or other clinical conditions. Some people who are basically those who have chronic diseases like stroke, hypertension, diabetes, they think a lot. So it becomes a constant movement of sadness to a particular cause, which this time is medical, that will lead them to depression.
What about age and gender? Does it have any link with depression, like in terms of the female and the male? Which of them is more likely to be depressed?
Well, according to the DSM classification, DSM is is our manual for diagnosing mental health issues. Mostly the balance is the females are higher than the males.
Really?
Yes, generally. The reason being, males are aggressive. They are able to kind of maneuver when issues are really hitting them hard. So, but there is no clear scientific proof to show that women are this. Just that it's statistics that show. Okay. And when it comes to age, there is no age that is exempt, or there's no one that is higher. Just that when people are aging, naturally they think, and the gray matter of their brain, that's the outer portion of the brain itself, the brain material, when it's growing older, sometimes you can have issues with depression. Sometimes we call it empty nest syndrome, but it is not depression on its own, but it manifests episodes of depression.
Father, we'll go for a short commercial break. We'll be right back. Welcome viewers. If you are tuning in now, you are watching Health Pavilion and we are discussing depression. My guest in the studio is Reverend Father Anthony Efriye Amponsem. Father is from Catholic Archdiocese of Kumasi, and he's also a psychologist at Careers and Counseling Center, University of Ghana. Father, before we went on break, you differentiate between depression and some other conditions. Are there any other condition that mimic, or if I say like of the same as depression, so that we can identify them when we experience?
Okay, I think your viewers may be interested in knowing other psychological conditions, or sometimes even medical conditions that can make you think that you are depressed. One of them is what we call dysthymic condition. You can have a dysthymia Dysthymia is a constant, influx of sense of depression, sense of loneliness and sadness. That itself may not, we call it persistent depressive episodes. Once a while, there are some people who are like that, and they are not classically defined as depressed. We also have what we call postpartum depression, which normally is for women. It comes just during pregnancy, just around labor, and just after labor. It could happen that it creates a little bit of chemical imbalances in your brain, and so you give birth and you just feel like, I feel like the baby, yes, the baby is causing you sadness. That itself is not depression, as it were, a major depressive disorder, which we call MDD. There is another one too that is called psychotic depression. Most people who have psychoticism, or people in the, this is a very bad language, we shouldn't use it online, but I want us to know that we say mad people. There are some psychotic people or people with schizophrenia who appear sad. You could see them walk around. They are psychotic, but they are manifesting, in psychotic episodes, you can manifest what we call the manic or depression. Okay, so they are not depressed. There is another one too that we call the bipolar disorder. And a bipolar disorder, you may feel sad, you may feel depressed, but naturally you are not, we don't diagnose you as depressed, because it is only one phase of your polar of mood. So you could be so manic and spending. Tomorrow morning you are sad. Okay. And the last of it is what we call the seasonal affective disorder. That normally don't happen in those who be watching us in Africa. It normally wouldn't happen because we don't have sharp differential seasons. So all of a sudden, from winter to spring to, it causes so many people in those sides of the globe, it causes them depression, but that itself is not depression. So these are some of the little things that differentiate a real depressed person, a major depressed person, and those who have other conditions.
Father, in your early explanation about the assessments, yes, you did mention an individual cannot know whether he or she is depressed unless a medical or a psychiatrist or a psychologist identify with some assessments. What are some of those things, so that we'll take note as my viewers are watching?
Well, the truth is, when you come to see a psychologist or a psychiatrist, the first thing we do is to create a rapport and to develop a history, what we call the intake assessment. We develop history right from your conception. So if you are not privy to those information, we ask for somebody else who was there. It could be that you were born with infant fatigue. And when, some people who are in a very long labor, about 2 days you are in labor, before the baby comes out, the baby is tired. Okay, so the baby starts depression from that point in life. It could also be that you infused your fetus with lots of sad hormones during your pregnancy. So we take intake from there, all the history through all that may have happened in your life, and we put one or two things together. When that is done, then we have what we call standardized and normed assessment forms that we ask you to fill, or we help you to fill. We could do it verbally, or normally we call it pen and paper. So you fill all those, we put them into the computer, and we generate another side. That would be, if we don't find depression inside of you and you are still depressed, the next thing is we will have to let you go and do an MRI to know there are portions of the brain that is responsible for your mood. So we do an MRI, scan the brain, know whether that place is inflamed or is crushed, and we will know all this. So we put so many things. That's why one person cannot just sit in your room and just say you are depressed. You may be sad. but you may
will
not be depressed.
So what are the other signs or symptoms like that a person will exhibit when he or she is depressed?
Okay. There are basically some areas we look at. Duration. So you should have been in that mood for at least 2 weeks. I said it earlier. Okay, that is the first thing. You should have that duration. Secondly, we want to know whether it is affecting your normal daily life. So you are supposed to go to work. All of a sudden, you don't do it again. You just don't feel like going to work again. It's affecting even your relationship at home. There are some people at the shops, you just go there, you look at their face, you don't feel like even buying anything. Okay, so it's affecting your normal daily activities. You will look at that side too. That is, so if it's affecting it, then it's a very clear sign. Then now we look at the classical signs. One of them is you either sleep too much, you want to avoid it. You want to avoid thinking about it. You sleep too much. It gives you lots of sleeping issues. You either sleep too much or you have insomnia. There are people who are depressed who will eat a lot because the body demands energy. They will eat so much. Others will lose appetite. Another classic thing is the lighting in your room and your choice of color. People who are depressed will prefer choosing dimmer colors, darker ones. They always want to isolate themselves. So if you want to see a person who is depressed, go to the person's room and realize that the person's bed is put on the side of the wall. You want to draw the curtains to get darker environment. Another thing is you have constant minor illnesses, headaches, what we call irregular bowel syndrome. Today you are running, tomorrow you have constipation, and you have neck aches, and you are constantly tired. That is another one. You are constantly tired. Then when it comes to thinking processing, you are forgetful, you are always missing basic things you are supposed to do. Again, you have what we call worthless. So if you come to the office, we have something we call the ODQ, on direct questioning. We will take certain things for you. So one of them will be, do you feel worthless? Sometimes you feel like life is not worth it again. So the ultimate thing that happens to depression is that you feel like committing suicide.
I was about asking you, what is the connection between depression and suicide?
Yeah. When you get depressed, when we diagnose you with depression, your thinking process will elicit something inside of you. You feel worthless. You feel helpless. Okay. And when these two are together, you feel suicidal because life is not worth it again. There is a portion of the brain that is responsible for survival. And when that portion is crushed, you don't feel anything as a threat again. You feel like that's life. Okay, anything goes. I mean, if you die, there's nothing. So it will elicit suicidal thoughts. And if you don't get help almost immediately, you might do it.
You might do it. We'll go for a short commercial break. We'll be right back. Welcome back, viewers. If you are tuning in now, you are watching Health Pavilion and we are discussing depression. My guest is Reverend Father Anthony Efriye Amponsa. Father is a Catholic priest and also a psychologist. Father, you did mention about other signs and symptoms of depression. Are there more? Because I know depression entails a lot, and what you've mentioned so far, I believe there are more.
Yes.
So we can identify our brothers or sisters or somebody in the community who is suffering from depression.
Yes, from the lay point of view, there are basic things that you want to look at. So first of all, you look at the person's personality. So if the person is generally the low person, it's okay. But the person who is bubbly and everything, then all of a sudden, see, for instance, the person is walking or talking slowly. It's one of the classic, signs of depression. The person is always bubbly, then all of a sudden the person is talking so slowly, fewer words. The person is always sighing. Sometimes the person can't sit still. The person is here today, wants to get up and go here today. The person can't really make decisions. Okay. The person also would sometimes want to avoid eye contact. So you are talking to the person is looking down, it's a clear sign that there is something wrong with the person. The person's eye brightness can also slow down. Sometimes you see the person is having very good white or a slightly creamish eye, then the person's eyeballs are dimmed, and the person would normally want to take too much water and be going to the washroom a lot. These are all signs. And again, the person finds it difficult to make decisions. Okay. And keep memory. So, today, will you want us to go to the mall and at least? No. Then the last one that you would find on the spot is what we call anhedonia. Anhedonia is this loss of interest in things that would normally make you happy. So you're a person who is always, you want us to go out to the mall, you want us to watch a movie, you want us to watch football, you want us to do this. Then all of a sudden, those same things don't make you happy again. That is a clear sign. So you can, our viewers can be, be on the lookout for some of these basic things. Yeah.
Is there treatment for depression?
There is.
Naturally or medically? Like you can either talk about it too, if they are.
There is treatment. Medically, we can give you what we call antidepressants that can elevate your mood, but normally that might be the last resort, okay? But we have psychotherapies that we give, and we have other technical things that we do in the therapy room that can bring you back. But these ones, I will think that in our next episode we could look at treatment and how to seek help, and we can go quite very deep.
Okay. But is there a cure?
Yes.
Going through all these treatments, would the person be cured of depression?
If we identify it earlier, sure. I know somebody who was so depressed. The person got to the point we call catatonic retardation. You are so depressed that your body shuts down and the person can't walk again. You can't talk. And the person wants to think, and you get convulsion in the brain. Seizure disorders were setting in, everything shuts down. But I think it was identified the very week that it started, though it ran too fast to that point. But within about 6 weeks and all, the person came back to normal, and the person is still around. So it can be treated. But if it gets to the extreme, we can treat you and manage you, but we can't cure you, as in it's off.
Oh, okay. That's what I wanted to find out. If it can be off, totally off in the person's system.
Yes, it can, but as I said, it's not a straight yes. It depends on the time it was diagnosed, how long you've been with it, and whether it is biological or non-biological. Because if it's biological, we could treat you easily. If it is not, it depends on all the other mitigating factors that we put together.
What about family support towards a person with depression?
That's a basic thing we do. That's the basic thing we do, because the underlying thing is what we call the sense of worthlessness. You remember I mentioned that, yes. So once somebody makes you feel accepted, it is the basic thing that we can do. So family support, what we call social support system, is one of the basic things we do for depressed people.
So, Father, before we draw the curtains, can you tell our viewers out there something about depression, so that in case they have somebody living with them, or if they themselves are depressed, what they should do?
So, those who are watching us, depression is a normal thing, and it is one of the commonest. It's like headache and malaria. Um, so once you identify it, you realize that some of these signs and symptoms, you are having it. Just go to any health center, or if you know a psychologist or a psychiatrist, don't think that you are mad. That word is too raw. There's nothing like madness. So seek help, and you can live the way you want to live, and the way especially God wants you to live. Depression comes, sadness comes, grief comes, disappointment comes. These will change your mood. But once you identify it in time, seek help, and I'm quite sure that you'll be fine.
Thank you, Father, for this wonderful education, and I believe my viewers out there have benefited a lot. Father is coming from the Catholic Archdiocese of Kumasi, and he's also a psychologist at the Careers and Counseling Center, University of Ghana, Legon. And to my viewers, thank you for watching Health Pavilion. Join me same time on Health Pavilion with me, Mary Magdalene Mensah. Bye-bye.